So I'm coming more not from like the social justice lens, like this is coming from a science-based healthcare study lens. So this could kind of delve into so many different areas. So we're just gonna kind of like lock it in on like how this is impacted from the science and health-based lens. Does anyone know the difference between weight stigma versus weight bias? Like if you could give an example, because kind of here we have like the stereotypes are the stigma and the negative attitudes are the bias. What would be an example of that? A weight stigma, a stereotype placed on somebody that's at a higher weight or at a lower weight.
The people who are big are lazy.
Yeah. So that could be like an example of like weight bias. So having that negative attitude, saying the word lazy, saying they don't have willpower, things like that, that's coming from a negative attitude towards somebody that could be at a higher weight. So stereotypes could be like how they're eating. You're assuming that they eat a certain way. It might not be necessarily negative, but it's just saying that I'm assuming that this person, based off of their body size, eats a certain way. That is a stereotype. Or that maybe they don't exercise. There could be somebody at a very, very low body weight that actually eats a lot. We don't know, but this is like kind of that stereotype that we're associating their weight with certain behaviors and then having that negative attitude. And this might not even be that you have the negative attitude, but it could be something that you're actually placing upon yourself. So when you get on the scale and you might see a weight change, your negative attitudes towards that weight change. So my question is, where did weight stigma start? Like, can anybody have any guesses on like where weight stigma started?
Barbie.
Sorry?
Barbie. I was just joking. Social media.
Social media, yeah, okay.
In public. Yeah.
Okay, so kind of like the stages of life is what we're looking at. What about like just throughout more like history?
Like society and like
Colonization.
fashion.
Colonization. Yeah.
And that's it. Like it was like from colonization. So this is actually where we want to like look at where this all started from. So if we look back and we think about like the Stony values, like when you're heading down, coming back from like if you're coming from Calgary and you're coming down the hill, you hear those different messages that could be about relying on the Creator, embracing sacredness, unity, coming together. So a lot of our bodies were celebrated. It was about respecting each other. It was about respecting what the Creator had given. That was a lot of the basis beforehand. You could see somebody that would be, this is kind of how it went. You could see somebody that would be at a higher body weight, and that was the sign that they were really good at hunting, that they were really good at gathering, that they were strong. There was a thought beforehand that where you were very thin, that meant you were a little bit sickly, that something was wrong, that maybe you had undiagnosed diabetes or kind of like the sweet disease before then. So this kind of started out, but then we looked into colonization and how residential schools came into a lot of this. So residential schools actually had a lasting impact that we are all fighting today. So when you have a child that is thinking about their hunger levels day in and day out, that actually raises their cortisol. That actually stunts and blunts how insulin is going to be functioning. Their insulin like growth factor doesn't work as well either. So their ability to actually control their blood sugars has gone down just surely from this situation they were dealing with in residential schools. And a lot of the behaviors get passed down. And a lot of the genetics get manipulated by that experience. So now we can see how that situation kind of trickles into present day where we're kind of assuming that none of that had an influence on somebody, that actually the weight that somebody is entirely under their control, that they did this to themselves. That residential schools and Europeans, that had nothing to do with this. It was all the onus on the person. Even outside of this community, Europeans came in and always had a stigma or used kind of like their white supremacy and wove it into different kinds of areas. So what we see is power structures at play there. So that you being at a lower weight showed a sign of self-discipline, a sign of moral value, a sign that you were better than somebody else. And this is how the white supremacists kind of exerted extra dominance on people. So we want to really acknowledge that that is a key thing that we're all trying to fight against, because we know and we can understand that racism is wrong, but we're not seeing how racism has actually intersected now with weight and even with gender stereotypes as well. So there can be a woman at a higher body weight that is from a racial minority that is dealing with all these different intersections of stigma. And that is completely what we need to be kind of cognizant of. And we also need to be very compassionate with ourselves, because we had to grow up in this kind of world, being fed these messages all day. So just as a note, even for myself, like, weight stigma is always going to show up. I was bred in the 90s. Like, The Biggest Loser was a show. Like, we all get it. So, like, this is what we're going to kind of see, like, where we're struggling to actually offer good healthcare interventions. So you might make your assumption on somebody based off of your client's size and that they maybe have some takeout in their diet, maybe they're not exercising, and then boom, we just diagnose them with with obesity, and then their prescription is weight loss. So oftentimes from the doctors, Mayra and I will get consults for client needs to lose weight, client obese. This isn't giving us any kind of an idea of how we're going to be working with them. So we don't know what is the barrier here. We're just making the assumption that they are at this body weight based off of their own control, that they just decided to buy takeout, that they just decided to not exercise, which is not the case. When we look at weight stigma and placing this blame on somebody that their body size is in their control, it has a whole host of different impacts on them. And this has been shown in multiple different studies, and even in populations in Indigenous communities. So there's a lot of work being done about how the health at every size approach is actually going to be way more fulfilling from an intervention standpoint than us diagnosing somebody at a certain BMI and prescribing weight loss. So, for example, screen time and a lack of physical activity goes up when a child has been stigmatized for their weight. If they're being bullied by their weight, they don't want to take care of their body, they don't feel proud of their body, they want to sit in that shame. So this is what we're doing when we hear these kinds of comments from either caregivers saying, oh, they're getting chubby, oh, they're getting like this. That is actually worsening their likelihood of wanting to participate in certain activities. So we need to know when talking about weight is going to be beneficial for the client. In the other areas, still in physical activity, a lot of people will try to overcompensate with physical activity, and this can really increase their likelihood of getting different kinds of injuries. So we want to be very mindful of when somebody is encouraging exercise, like what exercise looks like, and giving good anchors of what a healthy amount of exercise is. For mental health, just a note on the physical activity. When I was talking to different people in the community about this, I actually had one person, she used to always bike with her kids to drop her kids off at MCS, and she stopped because she had her sister say, what is that, like bear on a bike or something, that basically saying that her body size looked like she was some bear on a bike, and she never wanted to bike again. So she hasn't done it since. And that was just from that one comment that she heard. So you can see how it is extremely discouraging to hear those kinds of words. For mental health, there's an increased risk of depression and anxiety. So when somebody is not properly feeding themselves and not getting enough to eat, they typically will feel more sadness. A lot of their emotions will be elevated. So there's the increase of irritability that can happen as well. From a weight stigma side of things, there's also going to be an increased risk of eating disorders and disordered eating. And when I talk about disordered eating is more kind of like, it's not clinically diagnosed, but a person can undergo immense distress around food. versus an eating disorder is a clinical diagnosis. So that's kind of like where the change is there. But a lot of people are experiencing this kind of reliance on substances to control their appetite. They're using vaping, or they're going to be using ADHD medications, things like that, to control their body size. And none of this is actually impacting their health in a good way. We also have students that are at MCS that there is this fixation with being a certain body size, and they're actually skipping a lot of meals. They've been at to the point where they're passing out. So one girl had actually gotten a concussion from it because she's anemic and she's not eating and she's not taking that time, and it's about her body size. And we're going to talk more about where that comes from. But it's about this fixation about being a certain body size. We also had somebody that brought up that when their kids were brought in to the health center, they were told that their kids were overweight and that they need to stop drinking juice, they need to stop all the treats and everything like that. And what this did is actually made the parent never want to come back to the health center again. The mother felt like she was being shamed. The mother felt like she was doing a bad job. And the mother felt like all these assumptions were being made about how she's feeding her kids when she wasn't even asked about how she's feeding the kids. All those assumptions came into play. So that's the stigma. Those are the stereotypes that somebody is just feeding their kids certain things. What I find is hilarious, but not, is that this all actually results in weight gain. So a lot of this just comes into more chaotic eating patterns. So this stigma that we have with shrinking somebody is actually causing the exact opposite effect. It's not encouraging anybody. It's actually just causing more shame-motivated behaviors. So, and this can happen at both sides of the spectrum, and we'll talk a little bit about when weight can be beneficial to have included in the healthcare system, but this is kind of what's been happening. When somebody is experiencing this kind of like weight loss prescription from the health center, like when they're told to see me or I for weight loss, typically they think that they need to go on a crash diet. They think they need to get on track. There's a big kind of stress that or kind of balancing between these two realms of restriction and rebellion that we typically will see. So we'll have this feelings of shame when they are leaving the doctor's office. They feel like they're ashamed of their body. They feel like they've lost a lot of control, that they need to get back on track. They need to be disciplined, and that they need that kind of certainty and that autonomy day to day. So certainty is like, I know exactly what I'm going to eat tomorrow. I'm going to be in control. I'm going to get on track, and everything's going to be the way it needs to be. What this does is make somebody feel incredibly deprived and restricted, and that increases impulsive behavior. So the more that you're restricted, the more that you're following all the rules, you want to eventually rebel. So the rebel looks like, I have feelings of burnout instead of the feelings of shame. I'm just burnt out. I'm done. Instead of the fear of losing control, you have the fear of being controlled. I don't want to follow the rules anymore. I'm done. You need to feel rewarded for all your good behavior earlier in the week, and you want to have a sense of almost numbness. So it's I just don't care. So this is what I hear a lot, is that, well, I was really, really good all week, and then the weekend hit, and like I earned this. I wanted to treat myself. I wanted to do blank. And this is a very normal thing for people to do. We get fed this all day long, and I really want to encourage that I'm not stigmatizing anybody for if you have that mentality, because we have been fed this all the time. We still see it in just very subtle ways. It gets covered up and masked more and more, where we're not really getting to be in tune with what our body needs, and that our different kinds of outlets on social media are telling us how we should be living our lives and getting us more and more out of tune with what our body is telling us it needs. But once we are kind of like rewarded, and we've had our cheat meals, and we've had all of you might experience emotional eating, then that shame hits again. And that shame again fuels all of this all over again. So this is the back and forth that a lot of people will see. And it's not going to be empowering or motivating. You will feel stuck in the cycle, and it gets more and more chaotic, because you'll have more and more shame that kind of comes out from this. Then you want to restrict even more the next day. I'm not going to have breakfast. I'm going to over-exercise. I'm going to go do this. And then the rebellion kind of kicks in again after you've had that. So that's what I want for clients to know, is that that's not always going to be that's not going to be the appropriate option, and that we're kind of feeding into that in subtle ways. A different approach from the healthcare pathway is actually looking at the different causes, the actual root causes for somebody's health, and then giving the appropriate diagnosis, and then having the appropriate referral. So when I say that, when I was asking the community about like what their thoughts are on weight stigma, one of them really addressed the fact of the cost and the social dynamics. These kind of three: the finances, the access, and the household. If you have one person that's working in the household and you have multiple people in the household, and they have to drive to go to Cochrane to go get their food, and then they buy the food, they get all of it, they bring it home, and now it gets eaten up by everybody else in the household. And there's resentment. There is different kinds of arguments that are going on in the household anyway. Who's going to be cooking? Whose responsibility is it to cook? There's so much going on in these three areas that we don't understand why somebody might be just living off of takeout. But imagine, I have been working all day, and now I have to come home, and not only all my food's going to get eaten up, but I have to be cooking, I have to be cleaning. It would make a lot of sense just to go pick up a meal and have it to yourself. Because based off of my conversations, in Stoney culture, it is the responsibility to, when you make food for everybody. And that is extremely difficult when you're doing that every single day, day in and day out, with other like psychological stressors at play. It's not like this is the only thing that's going on for people. So having a look at that and just seeing that these rising costs of food is impacting so many more people where they're charging more for a family member to bring them to Cochrane to go get food. So it makes a lot more sense to just pick something up instead. But we, from the healthcare provider's side, we just think that that person is only eating takeout. And we stigmatize them. And we say that it's in their control and their lack of willpower. So that's what I find is we're putting too much onus on the individual when it's from the systemic side of things. But there's also the shame that people hold, the trauma, and then we're looking at kind of the pain side of things is that if somebody can't exercise because they have a knee injury and they're also feeling depressed because of that, that can trickle into how they're eating. And we need to understand where the root cause of the problem is. Is it the way that they're eating, or it was because of the injury that they're dealing with? And then how they're sleeping, the medications that could be changing, the education level that they have, and then the genetics and the epigenetics that I mentioned about from residential schools. So why wouldn't we give the appropriate diagnosis? What is obesity really going to do from a diagnosis lens? It's not helpful at all. This is actually addressing more of the problem so that we can make appropriate referrals. So if finances are the issue, then maybe they can be talking with the social worker about what their avenues are. If food insecurity and malnutrition is an issue, then Mayor and I could be there and say, these are really affordable ways that you can be using your groceries. What about if depression is the big thing that's going on right now? Then, and this is what happened today actually when I was on the phone. My client was saying, all my daughter does is sleep all day. She just sleeps all day, and then she just wakes up and wants takeout, and then she goes back to bed and she doesn't do anything. Depression can be a big thing that could be at play there, and we need to be flagging this, that it's not her fault that she's choosing that. It's just that she's probably only awake for one meal a day, and she's choosing something that's calorically dense to actually meet her body's needs. Everybody is just surviving. And so we need to actually look at these root causes of the problem. So, having them have a referral to maybe Turning Point where they can talk about what's going on in their lives and creating that space. Going and seeing Katie for the physio and making sure that the knee pain is not happening as much so they can get into different activities so that they can be building muscle around the joint. Because I wanted to really mention is that when we see somebody with knee pain and we say, oh, it's because you're obese, that is not ethical. That is not, and that's medical negligence at the end of the day. We need to actually be providing people with care. And so if I'm at the weight that I am and I have knee pain, I should be getting the exact same treatment regimen as somebody that's at a higher body weight. The problem is still the same. So it's just looking at the different areas and then looking into maybe they have sleep apnea, maybe it's hypothyroid, and then just being in terms of working with the team and looking at all the different kind of perspectives. As like Brent was mentioning in the flyer, like we do want to talk about language, and we want to talk about how talking about someone's weight is incredibly emotionally charged. It is just been like that from society's lens. Like we're not going to be able to fix that. It's just that we need to operate from a neutral lens when we're talking about weight. So the overweight, obesity, morbidly obese, when somebody hears that, if a doctor says, well, hey, you're obese, that information isn't doing anything for the client. Like, imagine that you receive that. You have clothes, you own a mirror. Like, that's not going to be something that is going to be beneficial in any shape or form, having it heard from a doctor telling you that. All you're going to be kind of thinking about is like, oh, I have a problem. I have excess. I'm unhealthy. All these different things. So really, let's just operate from a neutral lens. If a client comes in and they're saying like, hey, I've gained a lot of weight, it's like, okay, how do you feel about that? Like, we still want to acknowledge that that is something that the person is concerned about, but we just want to operate from like a neutral lens. So just like talking about their weight trend or their weight change, because we still want to use weight for certain kind of red flags. If somebody has dropped weight unintentionally, that is a red flag for something. We don't know what's going on. So we can talk about like, hey, last time you were in, you were at this weight. This is neutral. You were at this weight and now you're at this weight. Do you know what could be causing that? Because guarantee the client likely knows. So giving them a little bit more of that power that they're in charge, we're not making those assumptions about them. And then I asterisk the larger body and living in a larger body, because this is dependent on the person and your relationship with that person. So living in a larger body is acknowledging that things are more difficult when you are in a larger body, and we need to make space for that. So that's kind of like the purpose of it. But when we're talking about what we need to think about, is talking about weight going to be beneficial for the client or for anybody, even for coworkers? Is talking about their weight going to be helpful? If you turn around and somebody says, hey, have you lost weight? Oh my gosh. You don't know what that person is going through. So you don't know if they are depressed and they haven't eaten. You don't know if they're diagnosed with a medical condition. You don't know if they have cancer. You don't know. And even if they have been actively trying to lose weight, it is still never appropriate to comment on someone's body, ever. So this is something where if you think it's going to be beneficial for their well-being, sure, but oftentimes it is very rare we're talking about weight is going to be beneficial. So when to use BMI? Screening. So this is what I was kind of mentioning about that, like if we see a big change in somebody's weight that is unintentional, or maybe it is intentional, asking some questions to learn a little bit more. So how do you feel about your body right now? How does it feel to be in your body right now? Getting them connected with what the sense of being in their body is like. And then how do you feel about your weight change? Why do you think that this is happening? So just giving that space to kind of talk about it, because they could say, well, I did actually just have my medications change for my depression, so they cause weight gain. Okay. Like, end of story. The doctor doesn't need to say, oh, well, cut out the juice too. We never talked about juice. So it's just something that we're not making that assumptions on the person. Hey, what can a dietitian do? And this isn't even just a dietitian, but this is for all healthcare providers, but like just from our lens, this is our role at the end of the day. We want to kind of look at these root causes and screen for some disordered eating. That's something that the dietitian should be doing, is screening for disordered eating and kind of understanding, okay, are there thoughts and feelings around food, serving them in a certain way. Then you want to advise and kind of agree on like interventions or strategies that align with the client's sense of self. So what they find is important. What is going to be making their well-being improved at the end of the day. And then the last thing is kind of like assisting with validation, encouragement, and reinforcement. So I'm going to kind of give some examples of what this looks like. But I want to make sure I put this here as a reminder, is that this takes a lot of time. So like if you're referring to a dietitian, please plant the seed that they're probably going to be working with a dietitian for a while. When I'm counseling a client, I don't put pressure on them for follow-up. but I do strongly encourage it. I want them to feel like there's going to be a lot of priorities at play for them, and that this doesn't always have to be the front focus, but that changing our eating behaviors takes a long time. It takes constant kind of encouragement, changing your social circle, and learning different skills. So it should have, let the client know that they will need multiple appointments. And so kind of at the start of all this from the assessment piece is looking at those root causes. So looking at the income level of the client, looking at what their transportation looks like how often can they go to the grocery store? Are they going once a month, or are they going twice a month, or are they going every couple days? What are the household dynamics? So what's it like to be in the kitchen in that house? Really thinking about that. What is it like for that kitchen? Is it always clean? Do you have to, when you want to cook something, do you have to clean 70 different dishes at once too from the previous person? These are different kinds of behaviors that, or different kinds of situations where it's going to not encourage behavior change if they're not met. So we can't just say well, just go home and cook yourself a beautiful dinner that takes 2 hours. And then clean it all up and go home and make sure that you're spending at least $200 for one meal. We got to kind of work with where the client is at and what their body thoughts are, what their mood is like, when their mood is high and when they feel empowered and when they can do the most in the day and when their mood kind of tanks. If there's any kind of psychosomatic trauma, so meaning that have they dealt with certain kind of experiences in the past when they're eating? So a lot of times I've heard from different families that the child feels like they're being watched. So they actually can experience some trauma when they're eating because they feel like everything that they put into their mouth is being watched or looked at. So some of those things can show up, and the psychosomatic trauma can also kind of come out when, if you really imagine a child that has been going through bullying at school, a household that might just not be very encouraging for them, a bag of chips is the only thing getting them through. Could you imagine being a kid, or even yourselves, where you're just I have dealt with so much today, I cannot wait for blank. That is extremely beautiful that we can do that, but we view it as emotional eating or binge eating. That is an incredibly resourceful coping strategy. It's not going to be lasting. It's a very temporary solution, but it is still something that we don't need to demonize if that's all, for example, a child has with coping with certain traumas. Looking at the function and pain, the sleep routine, the medications, and the education. And sleep is a really big thing here. I don't think that many people understand how much sleep can affect our weight and how much stress can affect our weight. So we really, really need to understand that this isn't about just individual behaviors, that there are a lot of things that are outside of an individual's control. And then assessing for disordered eating. So this is things that I hear all the time, but they are kind of small ways of having disordered eating. And disordered eating, again, like I mentioned, it's not diagnosable, but it's something that causes a lot of distress for the person, and it can actually be very contagious. A lot of the mindsets can be contagious to other people. So for example, not letting certain foods be in the house or feeling addicted around food. I'm always out of control around this food. Going long periods of times of fasting to control their body size or starvation, and then eating to a point of feeling unwell. I can use an example of this, not from the community, but there was a gentleman that I was hiking with, and he says, you know what, I'm actually not going to have my hike sandwich because I'm going to have turkey dinner tonight and it's going to be so good and I'm so excited, so I'm just going to skip this so I can save all my blank for the meal later. Somebody opens up a bag of chocolate covered almonds on the drive home, and he, this is a Costco sized bag. He finished the entire thing, and he felt extremely sick. And imagining all the different thoughts that went on for him is that he was in that mindset of restriction. I'm going to restrict, I'm going to be on track so that I get this big reward after. And now he was sitting in this whole puddle of shame. He's I wrecked it. I don't get my turkey dinner anymore. I just had chocolate covered almonds. I don't know. I couldn't control myself. And it was really, really sad to see. But it was something where I kind of was viewing it okay, I'm going to see how this pans out. And I saw the arm go back into the bag of chocolate covered almonds, and it just kept it staying there. So, which is, again, it's your body's way of meeting its needs. Like, our bodies are so smart, and when they have been deprived, they're going to think of the quickest, easiest way to get what they need. Chocolate covered almonds is a source of fat, it's a source of sugar, it's going to be perfect thing to pep you back up after you've done a long hike. And we demonize this so much when our body is just actively trying to take care of us. When we are working with a client, we need to kind of think about what their values are, what's their character. We kind of start over in this kind of area. So looking at what's your identity? Outside of your body, who are you and what do you care about? Maybe you're a mother that's looking after some kids. Maybe you are really creative and you like cooking, or maybe you hate cooking. What is kind of like your values at the end of the day? And what does healthy look like to you? So health can be a bunch of different versions for different people. So understanding what health looks like to them, and then getting an idea of their thoughts and like their comprehension of what health looks like. So making sure that they have the right information about it, how they might feel about certain health behaviors, so their connection to those health behaviors. So for example, when I say that, is that you might be somebody who values nutrition and feeling good because you're an athlete. You might know that you need to make foods at home because that's healthy and making more home-cooked meals. But your emotional connection to cooking sucks. You hate it. You think cooking's the worst thing in the world. That is where cooking more at home might not be the fix here. So we can look at different areas there, and then looking at the confidence level is like your actual skill with cooking, not if you like it or not, but are you actually good at it. So this is kind of how it ties into a lot of Stony values. So, and a lot of coming into like building in your spirit and like having the self-awareness of what is actually important to you. And then kind of blending it with what your education is like for that. What are your thoughts around that, those different behaviors? Reframing what your thoughts are towards it. Like, for example, I hate anything related to dishes. Like, I absolutely hate it. And I hate unloading the dishwasher so much. I would rather just do everything by hand than unload the dishwasher. But one of my friends was talking to me, she's like, oh, I just love unloading the dishwasher. It's so satisfying putting everything in its place. I just love it. I love it now. It is so like satisfying. But just having one person presented in a different light can be really beneficial. So that's where oftentimes like having the support from multiple different caregivers or from friends, from staff can be really helpful on reframing health behaviors in a positive light. And then giving the skills that they need. So this is where we really try to intervene, is like understanding more about them, getting an idea of how much they know and like what information they have access to, reframing certain health behaviors, and then giving them the skills. So providing skills for not just only cooking for clients, but also about what grocery shopping can look like and how you can save money on groceries if that's something that's a big hurdle for a client. Or it could be even just about like being more in tune with their bodies and how they're actually eating. So any questions so far?
Do you have any handouts the same this information?
I can give you whatever you need.
Okay.
I have like the published studies, which are really interesting about how the increased rates of suicide, the different kinds of depression and anxiety levels that can go on for kids, and the impacts of weight stigma.
Mm-hmm.
But then just the language to be using as well, like things like that. Oh, there we go.
Yep.
Yeah. Thank you. Okay. Another kind of thing to look at is like when we're looking at our diet and our nutrition, instead of it being a certain kind of diet, it's this diet that fosters safety. So something that's all about making our clients feel safe. So the first thing to kind of look at is making sure when they're eating is being hit. So this is not just for clients, but for everybody, is that we need to make sure that we are actually providing our body with fuel regularly so that it can foster a sense of trust, so that your body feels like it can actually trust you to take care of it. Oftentimes when, for example, if somebody is at a very, very low body weight, like for example, a woman, she'll lose her period. Their body just said, hey, you can't even take care of you right now. I'm not going to let you make another human. So this is really important, is that we need to foster a sense of trust that our body knows, yes, it will get access to food. Because even just making a rumble in our stomach, your body has to produce energy to make that hunger cue. And sometimes if you've gone chronically saying no to a hunger cue, your body won't make it anymore. It'll just say, well, what's the point? What's the point of putting any effort into that? The next thing to kind of look at, not just when we're eating, so not just having regular meals at regular times, but also about how we eat. So are you really in tune with your body? And this is more about having interoception, which is a word kind of talked about with like being in tune with your body. So right now, as you can tell, my hands are kind of purple because I'm cold, and I can acknowledge that. But what we need to know is when we're eating is to be acknowledging that I'm chewing something. I like the color of this food. I really like that I added mint into this today. Like all these different aspects will increase interoception, which has actually been known to reduce cortisol levels and improve satiety with meals. So people can actually have a sense of almost like peace and contentment with their meals a little bit more. The last thing is the what. So this is what typically everyone is sending clients to MRI for, is the what. Like, what am I supposed to eat? When really these are the two more important areas to look at. But then once we kind of like have time to look at the what, that's about looking at the individual person and their needs. So are they pregnant? Are they an athlete? What age are they? Are they dealing with any kind of injuries? What is kind of like their primary focus right now? So then that's what will impact the what on the characteristics. But kind of going forward, we want to make sure that these are really important points, is that to really validate a person's experience with weight bias. So when I say that, I had a client come in and she was pregnant with twins. This wasn't here, but this was at another job. She's pregnant with twins. And she says, I wish that they could just eat up all my fat so that I didn't have to gain weight. And I'm like, in my head, I'm like, you are housing two beautiful humans in you. How can you think like that? Like, that was my first thought. I talked to her a little bit more, and she says, yeah, it was just like really hard for me when I was a kid. I remember being 8 years old, and my uncle put a scale out in the middle of the living room so that all of us could just go get weighed, and I was the heaviest cousin, and I got ridiculed my entire life for it. I don't want my kids to ever go through that, and I don't want them to be embarrassed of me because I'm at a higher weight. Now, the whole thought makes a lot more sense, is that people have had different kinds of experiences with weight bias and weight stigma, that it trickles into their own self-worth, and that we can't penalize anybody for having these thoughts. Even if you are providing weight-based comments, it's what you were brought up in. And like, we need to be really, really mindful of that. We are just presenting this awareness today, and that we can all kind of encourage each other to kind of break this cycle where we can, but we need to be compassionate with ourselves on where it came up for us. Like I mentioned, The Biggest Loser, that TV show, we were and like the different kinds of magazines, and then today it's just covered up more and more, where it's still there on social media, but in a much different light. So they are trying to actively cover it up. And then I also wanted just to make sure that we validate somebody's grief about body diversity. And when I say that, I mean, there could be two people that eat and exercise the exact same way, and they will not look the same. And there's a lot of grief that can come about that, is that maybe that person will never be that certain weight, or maybe your shoe size will never be size 12. Like, body diversity can be really, really celebrated in a lot of great ways, and it's what brings a lot of uniqueness, and it's what brings a lot of unity for a lot of people, because there's a lot of strengths that certain people have that other ones don't. Mm-hmm. And this was something that like really gets encouraged in society, in this community, is about respecting the creator and respecting all the bodies that the creator has provided. So encouraging traditional healing practices and traditional and holistic practices for movement and eating, and then reinforcing with a great social environment. I just wanted to make sure I had time to actually us to talk about it, because this is kind of like my last slide here. It's just about like what we can do kind of going forward. But these two top points are kind of the ones that I think are new information for a lot of people. Is just about like being compassionate with your own weight bias, and also being very validating for the client about their grief that their body size might not change. Any questions?
Just not communication sometimes. So we work with clients and the clients themselves without us saying anything, because we know not to say anything, but they repeatedly verbalize about how they unhappy about their appearances, and some of it also is because of medical issues, and so sometimes we just don't know what to say in that sense. So that's why I said perhaps with the communication or your materials that can teach us on what to say or to make them feel, I don't know, safe, or because sometimes it come across as really as a depression comes out, it shows that line of depression in there about their look and their physical appearance. But because some of us lack knowledge of what to say.
Yeah. It can be such a complicated kind of subject too, and because it's going to be, even like with different resources, every situation is going to be so different, and how the person is going to actually react and respond. So that one is really difficult, but it's first about it is about validating what they're going to say. Like these three steps actually come into play the most, is about the validation. Why are they bringing it up? So if they're saying, if they're bringing up weight, like I don't know the context of it, but if they're bringing up their bodies or their weight or certain medical conditions, saying, like, yeah, that is really, really tough right now. Like I can hear it in your voice that it sounds like the weight that you are at is bothering you. That's a very neutral comment. It's a very objective comment. It's saying, I can hear that is really, really impacting your mental health right now. What do you think could be contributing towards that? Like giving them that kind of space to almost process it is what our rules are. Our rules aren't to offer guidance on how to reduce their body weight. Our goal is to give them the space for them to kind of make an intervention on their own. So what do you think could be at play? Well, I don't have the time to kind of come home and cook and do all these different things. Or I'm just so stressed and I'm not eating and I'm not sleeping and I don't have the time to eat during the day, so I come home. Like listening and hearing that person is really, really, really validating for them, and they actually feel seen and heard, which is oftentimes what they don't get from different interactions that they might have with other people or with the healthcare system. The more that we can provide that space is way more beneficial without giving any kind of medical information, like any education. That space that you're giving somebody is much more beneficial for their health. Does that help at all?
Yeah.
Like, what would be an example that you're kind of thinking of?
Oh, it's just for having to know in terms of encouraging them to move from certain mental mood or state and into something that is positive. And of course then if maybe the diet could come into place, but I wouldn't know what to say because we're not trained to really say, okay, perhaps you should, it's just a matter of the communication of what kind of encouragement that one can. That's where I'm coming from.
Yeah.
Instead of not saying very little, I'm saying very little, but if somebody says more than once or twice, then it comes to me, okay. And maybe if I say this, if I know what to say or to encourage them, that's where I'm coming from.
Yeah.
Encouragement and leading them, guiding them to something that's more positive that they can look at or move from that state of depression.
And that's kind of like when it went back to that, like that first spot with the different kind of sectors of looking at their character and what they value. So giving them that kind of, giving them that space to really understand what is important to them. So if they're in, like, let's say, a depressive state, what does bring value to you? When was the last time you didn't feel depressed? What was something that made you feel less depressed? What is something that we can add in to your day that would help you feel more motivated? And giving a lot of it back onto the client, because the client usually always knows. The client has so much knowledge. We don't need to be providing a lot of knowledge. We just need to be providing them the space to actually talk it out so they don't even know what's important to them anymore. And giving them that space. Okay, what do you value? When was the last time you felt really good? When was the last time you were moving your body the way that you wanted? Nobody said that you had to go to BYC to that gym. Nobody said you had to go walk with a bunch of cougars around in your area. Like, we can figure out different ways. So giving them that kind of, that space there is really important, and making the appropriate referrals. So I am not a psychologist. So I will never ever think that I can do anything related to psychology. So giving them the space to be like, it sounds like this is like coming up a lot for you. Like, this is repeated, that you've been mentioning this. Do you want to, like, just have some time to talk just about this with somebody? I got so many turning point just for you. Or, you know what? Do you struggle with kind of bridging both traditional ways and this kind of newer landscape that you have? Maybe we need to talk to a cultural liaison. Maybe we can talk to somebody who can help you with maneuvering through kind of both worlds. Maybe we can talk about kind of like that identity that you have. So you can also give it off to another provider if you don't feel comfortable. Yeah. I don't know if that was helpful at all.
Yeah, that helps.
So many of our families live in, 2 or 3 families live in one household. But when an individual wants to lose weight, we are people that are, most of our diet includes meats all the time. And then fried potatoes and oven-baked bannock. That's mostly what we eat. I'm speaking for myself. But how, like, when you tell somebody that's grown up eating that's their diet, and you try to incorporate vegetables or healthy way of eating, that will just cut them off, their interest, eh? So how do you work that out with our people here in the community? Like, you ask them what we eat or what they have, and then help them plan their diet, or because if I was like, I am a meat eating individual, because I grew up eating wild meat as my everyday diet. And if I wanted to lose weight, and if I asked you, can you help me on my diet, and you throw all those vegetables and rice at me, I'm going to say no. And not no, but I'll be discouraged.
Yeah.
Why not incorporate what I'm used to eating into my diet, and then we'll work out a plan that works for me, so I can safely lose my weight.
Yeah. Yeah, like that's a great question. Like, it's always going to kind of depend on the person and the way that they're kind of meeting with us firsthand, and what idea of what they want. Because sometimes people think that they really want a meal plan, but most oftentimes a meal plan is just it's a Band-Aid fix. It's usually really unsustainable and hard for a client to start out doing, because it's foods that they're not used to cooking. Like, even if somebody was going to give me a meal plan and I knew how to cook all the foods, I don't have those foods in the house. I got to go get new foods that I've never bought before. Like, so it depends on where the client's coming from. If the client says, what can I do? What should I buy? Then we have a different story, because they've opened up that avenue that they are willing to buy something new. But there's a lot of times where buying something new, cooking something new, anything is off the table. So we usually start with like how they're eating, And I'll kind of go back to that safety diet where I talked about, like, okay, let's just make sure that you're eating regularly, that you're honoring your body's hunger, and that your body can trust you. Okay, awesome. I don't care what it is. And then how about being more mindful when we are eating? So having that connection with your food, you know, if it's, especially if it's meat and like those kind of, you have all those memories ingrained, that you can really talk about that and you can be with the family during that. And then with the what is kind of saying, like we look at like fruits and vegetables, they are all these different pathways that do happen. So kind of understanding where the client wants to meet us is like, this is kind of what we know. Where can you meet me here? So if it's based off of budget, if it's based off of I just don't like we can offer a new avenue for fruits and vegetables to get incorporated. That's like a big one that we'll have. Introducing it at an early age, so that's why like Josh will be working with like NSTEP and things, but also the budget is like the big thing too, and just making sure that we're using familiar foods and foods that the client actually wants to have. If somebody is really low in calcium, I can just tell them, okay, these are the different options. You tell me what you want out of these options. Because we gotta, like, just bridging kind of both those situations. Sorry, I know that you have that.
No, that's great. If you'd like to have more conversation one-on-one, that's great. I always like to quickly ask, what 3 things are you walking out with today? So we've had a great presentation. Again, thank you, Paige. This was wonderful. I picked up on a few good things, even for myself. What 3 things have you walked out with today that you learned? This side.
Weight neutral language.
Sorry?
The weight neutral language.
Weight control language.
Neutral.
Huge thing. Making sure that it's neutral. And that's why it's so hard. And it takes practice to be able to speak the language so that it is neutral. So practice it. If you make mistakes, you make mistakes, catch yourself, learn from it, and then figure out how to reword it next time to make it more neutral. Okay, behind.
Acknowledging that feeling and how they feel about that weight.
Great. Yeah, acknowledging. People have feelings, and then by acknowledging those feelings and getting more information, you get a better understanding of why their position and what's occurring. Because with that knowledge, then other plans can be made. So acknowledging them. Back over there. The 3 getting ready to leave. What did you walk out with?
That's the biggest takeaway for me. Something that Paige has talked to me about too is just understanding malnutrition a little bit differently, knowing no matter what size or shape somebody is, that they can be malnourished, and then being more conscious of that language, I think, for me is a takeaway. So.
Good. Anything else?
I think there's the health is not a size, and figuring out the where and how it impacts them.
Yeah. Good. All right. One thing that I walked away with was and the importance when one is eating to look at food and spend time with that food. You mentioned looking at the color, looking at the taste, and acknowledging that while you're taking it in. And that actually does cut down on your hunger urges and your need to eat more and more, because you're not just experiencing it one way, you're experiencing it a few different ways. It's like learning. You can learn better from different ways and stuff, and the more ways that you learn something, the more it'll be ingrained in you. With food, if you're thinking about it, what you're eating and taking a look and experiencing it, it does, to me, it does change the amount that I take in. So yeah. But again, we're over. Sorry. Thank you very much. If anybody wants the slides or anything, email or text Paige, and Paige might be able to send you her package or whatever. But thank you very much, everybody. Thank you. Paige, that was great. Thank you very much. Yeah, good job.